California today announced 13 different health insurance plans, which it says will give millions of residents affordable and quality coverage. The plans are part of California's new state-run health insurance market under the Federal Affordable Care Act. Joining me to talk about the new health care plans are Jan Spenceley, Executive Director of San Diegans for Healthcare Coverage, and Vince Mudd, President and owner of San Diego Office Interiors. Jan, insurers will sell policies in four broad categories of coverage. How do the proposed new rates compare to what they are for San Diego right now?
Well, actually, the publication of these rates was a real relief to me. These compare very favorably. In fact, on average, I believe they are 8% lower for San Diego than small group rates, and those are usually higher than individual rates. So I think they compare very favorably. And given all the projections of doom, gloom, 30 to 40% higher rates, this was a welcome relief.
And we have a graphic right here telling us what those rates, the average rates, are. Vince, the state has not yet announced its options for small businesses to buy health insurance plans, but the White House has said that it expects costs to come down for businesses. Do you agree?
I do, based on the individual market plan that was announced today. Because a small business market plan, if it's the same number, my current group plan for a 40-year-old individual is $356. In the exchange, the non-group plan right now is $340. So if it's already lower than my current group plan, it bodes well for my business group plan. But at the end of the day, small companies would like to provide some kind of care for their employees or know their employees are getting care. What happened today means that their employees can get good quality health care, and the rate that they would pay is reasonable.
So, Vince, you're a business owner. Then do you expect insurance coverage to expand for businesses or probably not shrink, right?
I don't think it will shrink because at the end of the day, if you're already providing it, it's not going to shrink. And as a matter of fact, you're going to benefit from the lower rates, even if you're already offering the care. So I don't see anyone dropping. Number two, most companies do not pay fines for things that they're not getting value for. So the odds of a lot of business people who currently offer the plan paying a fine or not offering it in the future just to pay a fine to receive no benefit for it, we don't work like that as capitalists. I think the truth of the matter is if there's a plan available, it's reasonable and affordable, gets quality care for my employees, most companies are going to try to find a way to get it.
But what Vince is saying runs contrary to what we're hearing from people who aren't happy with the Federal Affordable Care Act, right?
It does run contrary, but so far, a lot of those folks, I think, I'm not going to name company names, but that said that they were going to drop their coverage and they were going to drop their hours, they haven't done so. I think nobody likes to be told to do something or to think that they're being coerced into it. I think there's more reaction to that than to the reality that their health benefits, the cost of their health benefits, the growth in it will go down. This is the first indication, and we truly expect that to happen. Will some drop coverage? Possibly. They do right now. It's been declining for some years. Will others pick up coverage? Yes. And so how that works out, we have to wait and see.
So, Jan, Cigna, United Healthcare, and Aetna have decided to opt out of California's insurance exchange program. Is that going to hurt competition?
Actually, we have in San Diego 6 very good health plans that are, and there will be more, I expect, when there's some additional plans are allowed in under the bridge plan model. And I think that's good competition. If it's any willing provider, I think the exchange decided that it would be one, more complicated, but two, less competitive. You had less to offer them in terms of market. So I think we have a good array of plans here in San Diego. Excellent array.
Vince, very quickly, are there any disadvantages to what you saw announced today by the state?
Only one that I see, and that is there are employers who feel like they should have nothing to do with health care for their employees. And because these plans are affordable, some of those employers will be happy to completely opt out of the system. Not because of the paying the fine and everything else, but just because they now know they can feel better about themselves, that there's a plan available for people that's affordable. that is a good thing for some employers and a bad thing for some folks. So I just say that.
And I have to add to that, that's a good thing for the consumers, for their employees and their families.
Right.
And because what they get offered through the exchange may actually be more affordable and more comprehensive than what their employer-sponsored coverage is today.
And we've got to close it there. Jan, Vince, thanks for coming on the program today.
Thank you.